Warm welcome from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. I'm here with Charlotte and Mbuh and a number of participants, not all of whom are muted. How are you doing, Charlotte? Hello, Charlotte. Are you there? All right, Charlotte doesn't seem to be able to unmute herself. So we have here with us two guests. This is a third part in the series on gender and immunization. Shirin Heidari.
Hi. Unfortunately, the sound was breaking a little bit, but warm welcome to everyone. And it's always a pleasure for me to be here.
All right, thank you, Charlotte, and a warm welcome to all. We have with us Shirin Heidari from the World Health Organization and her colleague from UNICEF, Sagri Singh. Over to you, Charlotte, and I'm going to ask both Sagri and Shirin to, thank you, to turn on their cameras. Go ahead, Charlotte.
And we also have with us today Michela. Reda, we also have with us Michela Manna, still from WHO. So if you could kindly make her co-host, she's with us also in the room.
Okay,
so
wonderful.
So we are going to dive straight in. It's a pleasure for me to receive you today, Sadki and Shirin. So before, I know Shirin, is not the first time for us to receive you here, and we have a number of people that already know you. But since we get more and more people join us every time, please, can you kindly introduce yourself? Tell us who you are, where you work, and then we'll turn towards Sagri afterwards.
Great. Thank you so much, Charlotte. And it's always a pleasure to be here with you. My name is Shirin Heidari. I'm a senior technical consultant on gender, working closely with the gender equity and rights team at WHO and also supporting the immunization, vaccines, and biologicals department at WHO. And I don't know, Charlotte, if you're also aware that we also have another colleague from UNICEF with us today, Sagri Singh, who is also another gender expert. So we are really delighted to have her with us. So maybe allowing her to introduce herself afterwards. Thank you.
Of course, Shirin. So we are turning now to Sagri, that has been with us in the room for a while now. And please introduce yourself. Tell us who you are, where you work, what do you do?
Thanks so much, and good morning, good afternoon, and good evening, everybody. Thank you for having me here. It's such a pleasure to be part of this discussion and to learn from all of you, as well as to share what I know. My name is Sagri Singh. I work with UNICEF as a senior gender advisor. And one of the parts of the work that I do is around supporting our immunization and health teams around gender equality issues in the work that they are leading. I also, as you might be aware, UNICEF has a gender action plan. And so part of my portfolio is also promoting the rights and empowerment and well-being of adolescent girls through the work that UNICEF does. So thank you so much, and I look forward to a really good discussion. Over to you.
Thank you, Sagri. So I'll turn to our next guest, Michela. Michela, you are not new to our lightning chats, but please just kindly introduce yourself. Tell us who you are, where you work, before we dive into the question that is addressed to you.
Thanks, Charlotte. Hi, everyone. My name is Michela Manna, and I work as gender specialist for the Global Polio Eradication Initiative at WHO.
Thank you, Michela. And over this is the third part of a series of lightning chats that we have had on gender and immunization. And each time people keep saying it's such an interesting topic, a rich topic. We want to come back and listen. So over the weeks, we in the past sessions, we've heard two words come up very often: equality and equity. So what is the difference between these two words within the gender context?
Thanks, Charlotte. This is a very important question, and I think it's very important to clarify. We normally refer to gender equality as a fundamental human right. And when we talk about gender equality, we refer to the equal chances and opportunity for everyone to access and control social, economical, political resources. So gender equality is the absence of discrimination based on a person's sex or gender identity. Apologies. And it means ensuring that so the same opportunity is accessible to each person, such as access and control of social, economic, political resources, including the protection under the law, such as health services, education, or the right to vote. When we talk about gender equity, we talk about the process of being fair to women, men, and those with diverse gender identities. And gender equity also recognizes that individuals of different gender identities have different needs, also different power and access to resources, which should be identified and addressed to rectify the imbalance that there might be. So this may also mean that the different treatment is needed to ensure equality of opportunity. So we can say that addressing gender equity leads to gender equality. But also I leave the floor to Shirin and Sagri in case I'm missing something. Thanks.
Thank you. I see Sagri's thumbs up also from Shirin to say like that's satisfied. All right. So if you are with us here in the room or you're watching via social media, Facebook, Twitter, LinkedIn or YouTube, please don't hesitate to type in your questions. Here, for those here in the Zoom room, you can also raise your hand to share your questions or type them in the chat, and it will be a pleasure for me to read them out to our guests who will be delighted to provide answers to them today. So my next question is for you, Shirin, and it's on the COVID-19 pandemic. So what has been the gendered impact of the COVID-19 pandemic, and how does it affect immunization?
Thank you so much, Charlotte. That's an important question. And we know that it's not only about COVID-19. Any kind of outbreaks and pandemics can have an impact on immunization programs and result in other disease outbreak as a result of that. We know, for example, from the recent Ebola outbreaks in West Africa, in Liberia, in DRC, which resulted in measles outbreak as a result of disruption in vaccination programs. And the same goes with the COVID-19 vaccine. Studies have shown that there has been a reduction in vaccination coverage, a reduction in the total number of vaccines administered, and as a result also an increasing number of children who are missing their vaccine doses. In some polio-endemic countries, we have also seen an increase in polio cases, which I'm sure Michela can speak more to that. And factors contributing to this decrease in vaccine coverage are both on the supply side as well as on the demand side. On the supply side, there are disruption in services as a result of allocation of resources from, say, child health programs to pandemic responses, but also healthcare workers can be contracting COVID-19. There can be a shortage of healthcare providers. There can be a disruption of supply due to travel restrictions and so on and so forth. And from a gender perspective, there have also been documented disruption in reproductive health and maternal health services, which are often also entry point for immunization services. But there are also a number of reasons that are related to the kind of the demand side. Mothers are often responsible for children's health in many settings and may while they might not always have the same resources or decision-making power to make those decisions. And these gender-related factors are often exacerbated in the context of pandemic. We know that movement restrictions can affect women and men differently in different geographical locations. Fear of being exposed to COVID-19 at the healthcare facilities, in waiting rooms, and during transportations, they can also vary by gender. And we also know that COVID-19 has resulted in women carrying a disproportionate burden of care with school closure. They're working from home. If they have a kind of a income generating job, at the same time, they also have to care for both children and potentially those that in the family that are sick and are suffering from COVID-19. So that can also result in, time constraint, and also many women has experienced the loss of income. So all of that together can really result in kind of gendered implications and impact on immunization programs, as well as gender-based violence, which we know occurs both in the domestic spheres as well as in the healthcare settings and healthcare workers.
So what measures need to be taken to prevent exacerbation of gender inequalities and inequities as a result of COVID-19?
So importantly, when we are rapidly trying to mobilize and intensifying vaccination programs kind of as a response to the disruption that occurred during pandemic, it's really important that in each context examine what are the specific gendered impact of the pandemic on women and men and how these influence the decisions about immunization in that particular settings. That means that we need to collect data to identify how gender roles and expectations influence vulnerability to infection as a result of COVID, but also access to and uptake of health services, including immunization services, ensuring that we have trained healthcare providers and vaccinators, that they can identify and address gender-related barriers in the demand and access to routine immunization programs in the context of pandemic, and how the new programs that are developed for recovery must really take into account the gender considerations. And most importantly, specifically in the context of COVID and a lot of myths and misinformation, in particular related to immunization and vaccines, important that communication material, whether it's print, whether it's graphics, whether it's audio visual, that including social media, are also accurate and also gender sensitive in a way that can take into account the differential access and kind of digital literacy or health literacy, and make sure that does not include gender stereotypes and can resonate with women and men about health decision and including immunization decisions. But that's some ideas, and I'm happy for Michela and Sagri probably have much better ideas to kind of share.
Thank you very much, Shirin. Before we go to our next question, we'd like to take some comments from our Facebook audience. Reda, over to you.
Hey, Charlotte. Yes. So right now we've just got people saying hello. This is a lightning chat. You have 15 minutes to ask your questions about around gender equity, immunization. I do see some newcomers. So like Balaniesa Kumar from India, who says hi. Lara Adeyemi from Pennsylvania. Atawaseli Katamba, who's joining from via YouTube. Don't forget to tell us, just like Madonna Anabiesa did, where you're connecting from. So she says, beautiful evening from the Philippines. We'd love to know what city as well, if you're okay with sharing that. Daniel Huruna from Abuja, Nigeria. Steve Mwangi from Kenya. Gaston Wamba from Cameroon. Wagas is his nickname on Facebook. Hajara Musa Suleiman from Abuja. Taye Girma from Ethiopia, and who says he's learning. Rajat Garg from New Delhi, India. Ismail Nasiro Guarzo from Kano, Nigeria. And our very own Amel El Taher watching from the Kingdom of Saudi Arabia. Those are some of the greetings. And remember, as you're listening, think about what are your questions, the questions that matter to you. We also have participants in the IA 2030 course with us in the Zoom studio, and we'll be going to them shortly. Back to you, Charlotte.
Thank you so much, Reda. So my next question is to you, Sagri. What gender-responsive strategies need to be put in place to overcome gender-related barriers faced by immunization service providers?
Thank you so much. And I'm glad we are focusing on the service providers as well as the clients or the women and their families who are accessing these services. You know, there's a very common statistic that's thrown around these days that says about 70% of the health workforce are women, but in fact, less than 25% are in leadership roles. And I think that's really a stark recognition of the inequalities that exist in the health workforce and in the profession. So in terms of what's required, I think we need to think about this in two levels. One is at the policy level, it's really critical to take into account the barriers that women might face in being able to deliver the services. We know that policies for the large part don't have a gender lens, but when they're applied in societies and economies where there are gender hierarchies, it really plays out in very different ways. So for instance, in most of the countries we work in fact, all countries, there is this issue that women take on the largest burden of household care. That doesn't shift when they're taking on a work responsibility. And as a result, it's really critical to have some flexibility in the policies that enables them to be able to both deliver on the work and support at the same time their own families. The other aspect I wanted to talk about was recruitment and remuneration. We know, for instance, that recruitment of healthcare workers in many communities and societies is often done at the lowest level. And sometimes when you have higher levels of recruitment, you have these education barriers that women in the society and the communities often don't have. So really trying to ensure that we have opportunity to recruit women to all levels of the health workforce is critical so that they can be supervisors and they can be trained in a way that enables them to take on professional supervisory roles and be leaders in their work. Another part of this is remuneration. We know that oftentimes women are in the health workforce in the front line doing the bulk of the work and getting the least pay and recognition. So it's really important for us to look at our policies and our remuneration policies to see how we can actually professionalize the workforce while at the same time providing them with the right amount of remuneration or salaries that's required to keep them in the workforce and to facilitate their work. And then the last part is around all of the issues that women face in their communities, health workers face themselves. So issues around harassment, violence, whether in the workplace or in the community itself. Oftentimes, there is also issues around mobility and security. So how do we, as policy makers and practitioners, ensure that policies really are taking into consideration these factors and putting in place the right issues and the right policies to make sure that there is the women are secure, that they have access to services themselves, and really their training takes into consideration all of these different factors. So I'll stop there for now, just to talk about all of these different barriers that impact frontline health workers who are largely female, their ability to provide services to their clients who are largely women as well. Thank you.
Thank you very much, Sagri. I would like to find out from you, are there any tools available that can help to implement these strategies? And before you answer the question, I want to help out some of our francophone attendees who are in the room. S'il vous plaît, l'interprétation simultanée fonctionne bel et bien, mais vous devez cliquer.
So if you need interpretation, it is working. You need to click on the icon interpretation. It's an icon that looks like a globe on the top bottom, and then once you select French, you will be able here to follow. So this meeting is available in English and...
Over to you, Sagri.
Thank you so much. There are a number of tools that are available, and there's a significant amount of work that has already been done or written up in the literature that we can definitely share. But a couple of things that I would like to flag is there is one particular framework that speaks to gender equality in community health work, and that was led by Rosemary Morgan and a group of colleagues from Johns Hopkins University, but also other organizations. There is a gender analysis of community health work policy that UNICEF is actually leading with the UN University in 3 countries, Niger, Mozambique, and Zambia, that we will be putting out shortly. And then there's a lot of other sort of short tools and checklists that colleagues can look at to really identify what are the barriers. But I think the main thing that I would recommend is talk to the frontline health workers themselves. They are a fountain of expertise and information, and they can really guide us on what are the issues and the challenges they face and what are solutions that they think would be most valuable and most useful for their context and for their clients. Over from my side. Thank you.
Okay, thank you very much, Sagri. And we have here in the Zoom room Sekuba. His hand has been raised for quite a while now. And I'm going to invite Sekuba to unmute himself. He's a French speaker. So if you want to get the interpretation into English, click on the interpretation button and select EN English so that you'll be able to hear what Sekuba is saying in the English language. So Sekuba, vous avez la parole.
Oui, merci beaucoup Charlotte pour.
Thank you, Charlotte. And thank you very much for the panelists. I think you are very clear in your explanations, and it's very important for us when it comes to equality and gender equality. My question, can you introduce yourself? Yeah, sorry, I'm Sekuba. I'm a PhD student. I'm doing research for my PhD on the medical anthropology, and I'm working in Mali, very close actually to the border with Guinea and Mali. And I'm also working on immunization, and I'm also working with the vaccinators for the pandemic. So in my work, I've noticed here strong inequality between men and women. So I'd like to know, what are the strategies implemented to rebalance things, to have this equality between men and women? I noticed that it's very much in the urban, in the cities. Indeed, this is discussed, but not in rural areas. The other day, I was in a village and I asked her a question when it comes to why was she late for vaccinating her child. And I just asked, why did you take so long to get this vaccine? And she simply said to me, she did not get the authorization of her husband. So she wasn't a decision maker. So why don't we have a better communication to men? Why can't women take these decisions even more when it comes to the health of the children, of their families? And in Mali, that's what we've noticed. Usually, you have to really involve men too, because women don't have this option to take decisions in these rural areas in Mali. So I was wondering, what are the strategies you would recommend to overcome these barriers and improve immunization and gender equality? So what are the strategies here so we can be more effective in rural areas? Thank you very much.
So I would like to
thank you very much, Sekuba.
You, Shirin, you have listened to Sekuba's concern. What do you have to say in terms of inequalities between the roles of women and men when it comes to decision making?
Thank you so much, Sekuba, for your question, and Charlotte. And I'm definitely welcoming Sagri and Michela, who are more experienced in immunization programs in particular, to share. The issue of gender equality is really entrenched in our society. So we really need to address that from multiple levels, institutional level, when it comes to policies and laws, and how can we make sure that we are creating a legal and a policy environment that is responsive and is gender equal. We have to have those conversations at the community level to make sure that we understand where are the root causes of the gender inequality and how can we address that. And we also have to have these communications at the individual level. So it is really a kind of a comprehensive approach. And Sekua, as an anthropologist, you have a very great position to really identify those nuances that you cannot capture by quantitative data. So I think you are in a really good position to really understand the complexities of the issues, but also the experiences of women and men. How are their issues and their perspective? What are the particular gender barriers to immunization? And you have already mentioned one, and that is around decision-making, for example, power. So I think these are really complex issues. And when it comes to immunization, I think it is really important, you are highlighting that very correctly, that we also need to engage men in this conversation. I think there has been a lot of emphasis on how can we reach women, how can we empower women, but I think this also requires an engagement and a conversation of men as fathers, because gender equality also benefits men to a great extent, both in terms of health and well-being, but also in terms of, childcare responsibility and bonding with children and being more involved in those decision-making. And I think that is actually an important point that you raise. And I'm letting Michela and Sagri, who perhaps have additional examples and comments, to share. And I see, sorry, Charlotte, I also see that there is another question from Joyce Muriti in the chat. We can also not forget to respond later on.
Yeah, exactly. Before we turn towards Joyce's question, there's actually a question from Facebook from Daniel Haruna that says, how can gender roles and responsibilities play on vaccination, particularly during the pandemic? And I'm sure it's in line with what you said earlier, but I would like to turn towards Sagri and then Michela. So, Sagri?
So thanks so much. I mean, I think that just building on what Shirin said and the question that was raised, there are some key strategies that we can take on. So one is that when community health workers or when health workers are talking about vaccination and encouraging households to be vaccinated, to bring their children for vaccination, having joint discussions with the husbands and the wives or the families in the community becomes really critical. Because if you continue to just talk to women or just talk to men, you're keeping that role separate. But having a joint conversation facilitates that discussion within the unit that allows for some equality of decision making that could happen and agreement to move towards an immunization strategy. So that's one piece. The other is this idea of role modeling. We all look up to role models. And so some of the work that UNICEF's done in different countries is really having, sports stars or film stars, people who have a very large gathering talking about the importance of supporting their families, supporting their wives in doing childcare, in doing household work and things like that, that allows for encouraging them to take on more of that work and providing a different way of living and being and having a relationship. I think the last point that I just wanted to flag on this is that it is very important to engage men and women in this process. But what's really for us to be aware of is not to end up in a situation where we then relegate women back to the role of back to the household. So, we kind of elevating men's decision-making power, we're reaching out to them, and then we're reinforcing that power imbalance. And I'll give you an example in one country where, when men and women came to get their child vaccinated in a clinic, they were brought to the front of the line. And where women were just on their own bringing their children, they were delayed. They, had to go to the back of the line. And we can appreciate that it came from a very good place and that you wanted to encourage more men to participate. But what it was showing was that you were giving men, the couple and the man in particular, more sort of recognition. So okay. I just wanted to flag that important point there.
Thank you very much, Sagri. We are almost out of time, and I still see the questions that are coming in here in the chat. So I'm going to read out Joyce Muriti's question, and then my last question, and then we'll start with Michela, and we'll end up Michela, Shirin, and we'll end up with you, Sagri. So Joyce Muriti says, my experience with COVID-19 activities, I see more women in the line waiting to take vaccines than there are men. Is this something that is happening elsewhere in the world? In this case, what are we doing to also target men, as IA 2030, who influence may be a handicap to women decisions in immunization and other healthcare services uptake? I'm sure we have had to look at this. And then my last question for all of you is, how can IA 2030 scholars who are here with us in the room make sure that their proposed actions can help to address gender-related barriers to access and provision of immunization services? So we'll start with you, Michela, and we'll end with Sagri.
Thanks, Charlotte. So on the first question about the COVID vaccine, well, what are we going to do to target men? That is about communication. That is about, as Sagri said, targeting not just women but also men in the right way. Try to be gender responsive, and that it depends a lot on the context. You know, the thing that can work in a particular context cannot work in another. So unfortunately, there's no just one answer to that. We would like it to be that easy, but you know, you have to tailor your communication and your intervention to that context. You have to know that context and the gender barriers of that context. I think that for scholars, to integrate gender in their action plan, I think for them it's really important to think about what gender-related might hamper their or might influence their action plan, in which way and what barriers. And I think that the tools that we shared and the additional discussions that we will have will help them to recognize those barriers. But I'm sure they already saw those barriers, because from all the experience that scholars are sharing, we know that they know those barriers. So it's just a matter of kind of taking them into account and really mainstream in their action plan.
2 words, Shirin.
Great, thank you so much. And to answer to Joy's question, Joyce, there are studies that look at COVID-19 vaccine uptake and hesitancy, and there are conflicting results. In some settings, women are more ready to take the vaccines and they are less hesitant. In other settings, actually, women have been shown to be more hesitant and less likely to take the vaccine. So there seems to be great variations, and vaccine hesitancy is very much around the perception of disease, how much they think they're at risk, at risk of getting COVID, for example, but also around confidence about the safety and efficacy of vaccines and other aspects as well. So I think that's, again, coming back, the importance of collecting really data in your settings with regard to, what are the perceptions, what are the communication strategies, what are the perspective, what are the barriers to vaccine uptake? Is it barriers to access, or is it barriers in terms of willingness or hesitancy? And I think those are going to be important for you to identify where are the challenges and obstacles and bottlenecks in substantial COVID-19 coverage. And
thank you very much, Shirin.
Sure.
Unfortunately, we are out of time.
There is a gender annex that will give you very specific guidance